Feline leukemia (FeLV) is a contagious disease, very common among cats, in which it causes high mortality. The FeLV virus, retrovirus, is transmitted by the infected cat via saliva, secretions or blood, and this can also occur in the initial stages of infection, when the cat still does not show any symptoms. FeLV is usually transmitted between infected cats when the transfer of saliva or nasal secretions is involved. If it is not defeated by the animal's immune system, the virus can be deadly. The disease caused by this virus is a form of blood cell cancer called lymphocytes, a type of leukemia. A cat, if infected, can transmit the infection to kittens during pregnancy. The disease preferably affects young cats, especially stray cats or those who live outdoors. The feline leukemia virus, FeLV, is an important cause of neoplasia in cats. It is also the cause of anemia, immunosuppression and immune-mediated diseases. Adult cats are less susceptible to FeLV infection than kittens, and most viremic cats are less than 6 years old. Clinical signs. The feline leukemia virus is present in saliva and the infection follows the oronasal route, presumably for mutual cleaning of the hair between cats. After penetration, the virus disperses into systemic lymphoid tissues. During this stage, many cats eliminate the infection without developing clinical signs. As a third alternative, the cat may contain the infection within the bone marrow in a latent state for a variable time. Occasionally, infected cats in latent conditions can return to the viremic state. This can occur spontaneously, following the administration of corticosteroids at immunosuppressive doses or after physiological stress such as lactation. Laboratory tests. In FeLV infections, regenerative anemia is present individually or associated with a decrease in lymphocyte, neutrophil and platelet counts. If the white system is affected, neurological signs may appear. If there is renal involvement, there will be signs of renal failure. Useful tests for diagnostics. Hematological tests are used to check the state of anemia and determine its type, regenerative or non-regenerative. ELISA tests are useful for detecting the virus even in asymptomatic subjects. It is recommended to retest subjects after about 12 weeks for confirmation of positivity or to confirm by viral isolation test, especially in asymptomatic subjects. Viral isolation, only possible in the laboratory, identifies the blood type virus with absolute certainty. Prognosis. The prognosis for a persistently infected cat in an environment with other cats is often unfavorable, as about 85% die within 3 years of diagnosis. Persistently viremic cats that live in an environment without other cats may have a slightly more favorable prognosis, since the number of opportunistic infections to which they are exposed may be less. Sometimes infected cats can live from many weeks to 3 to 4 years, depending on the subject's state of health. The stage of the disease at the time of diagnosis and therapies. Treatment. There is no effective therapy against the virus of feline leukemia. Symptomatic therapies can be adapted on a case-by-case basis. In recent years, a therapeutic protocol has been prepared with omega interferon (IFN) of feline origin, which gives variable results based on the degree of infection of the subject. The only approved treatments for feline leukemia are omega interferon in Europe and T-cell lymphocyte immunomodulator in the United States. But other treatments are being investigated. Prevention. Different types of feline leukemia virus vaccines have been recorded. They provide some protection against the development of persistent viremia. The most appropriate time to vaccinate a cat is in the first year of life, although it can be done at any age.